So the thing that we talked about before is putting the electrode lower on the forehead.
Yes.
Yeah. So, and using the device more as far as, I know you're trying to use it and you're above 50%, but
It's tripped off right now.
Yeah, it's rough.
So let's change and use the other box.
Okay.
Okay.
And see if that can give you a longer time of treatment per day. And then for this new area that's lighting up on the new MRI,
Yes.
I think you should treat that with radiosurgery.
A gamma knife or something?
Gamma knife, for gamma knife you have to screw a frame on your head, and it has precision, but you really don't need the precision so much, because it's more of a fuzzy area, let's say. So I'm associated with a CyberKnife Center, and we also have a frameless radiosurgery center in Evanston. So, or you could do it closer to home, wherever you want, but they could, or they could give a boost to that new area that's lighting up.
The radiosurgery, is that a one-time operation?
It's a one-time radiation boost.
Okay. Do they crack open my skull at all?
No.
Or just...
It's radiation treatment. So it's minimal discomfort. It's not like, they call it radiosurgery because, like surgery, it destroys what it's focused on, basically.
Okay.
But this is in a safe enough spot, so you should be able to tolerate it. Could there be side effects like necrosis, which is dead cells like you have in the middle of the bigger tumor area? Sure. But I would have an aggressive approach to this, and if I saw new spots, I'd recommend zapping those with additional radiation.
You'd be aggressive because this little tumor you feel is aggressive and wants to take off.
And it's not really a tumor. A tumor kind of means to me like a lump. And glioblastoma isn't so much like a lump, it's more of a cellular process.
Okay.
The cells are getting mixed in with your brain cells. And that's why you're doing the Novocure, and that's why you've used chemotherapy, and that's why you've used radiation. And now another option is to give, when they're lighting up, new spots to boost those.
Radiotherapy.
It's called radiosurgery.
Radiosurgery, okay.
Yeah.
Okay.
And you can do it with a frame, like gamma knife, or there are frame-based systems, but those involve numbing you up and screwing a frame on your head. I don't think you need that kind of precision. If you do radiosurgery, I think you could use a frameless system.
Okay.
So you don't have to go through the discomfort of having a frame put on your head.
Okay.
Which some people tolerate. They don't. Just like some people going to the dentist, it doesn't bother them at all, and other people, they just hate it. So, I'm one of the kind of people that hates it. So I wouldn't want a frame screwed on my head if I could avoid it.
All right.
You know what I mean?
Let me ask you this, if I could, sir.
Sure.
They took a sample of the tissue, and this methylated thing, it looked very promising. I got an 11, you needed a 2. For the Temidor, it looks like, oh, this Temidor is really going to kick butt. Temidor apparently failed. Temidor is...
Well, Temidor is probably doing something. It's probably killing some cells, but not enough.
Okay. So my doctor said he's going to put me in Avastin and give me a drip next week, and then I think it's 4 weeks. Possibly go back to Temidor, depending Avastin, and then Temidor after that.
In addition, he said. In addition, not after.
Sound like the right thing to do, regimen?
Most people are doing that.
Okay.
Most people are doing CPT-11 and Avastin after things have progressed, despite Temidor, radiation, and surgery. So I would do it. I mean, it's easy for me to say because I'm not being the one to have chemotherapy in my body, but that's the usual recommendation.
Yeah, I mean, I tolerated the Temidor very well. And I mean, I'll be sick and tired. I don't care, but I just want to cure this thing.
The radiosurgery is easier.
It is.
Okay.
You can't treat it. The enhancing area, the area that lights up, where your original surgery was and tumor is too large for radiosurgery. But the new lesion, where it's getting deeper, you could treat that with radiosurgery. Is it guaranteed to cure it? No. But all these things together, you're treating it very aggressively. You're trying a new chemotherapy. You're doing the novo cure, so you're throwing everything at it that you possibly can.
Our other doctor, Dr. Malkin, had said, based off of this scan, due to the short echo one or whatever, the choline peak being higher than the NAA peak, he said that he feels that the newer lesion is our like top priority. It's like their number one threat. Do you feel that there's like one area that's more of a threat that you said radiosurgery would be more effective, or are they equally like destructive and threatening?
Well, I'm concerned about the new one, and I would treat that. And
okay,
they're all concerning.
Okay.
Because it starts with a single cell, so we want to eradicate all the cancer cells.
The original one, doctor, is that more stable and not growing?
Yeah, that looks more stable to me. They measured it.
Okay. Okay, radiosurgery. Let's look at that.
okay.
Yeah. And that's what I had said last time too.
I remember you talking about a gamma knife or something like that.
No, he said radiosurgery.
Okay. The location of the new one with radiosurgery, that's inoperable. That's a part of the brain.
It's not inoperable for radiosurgery.
Okay. But with a knife it would be.
Yeah. I wouldn't recommend the knife for that new spot.
Okay.
It depends how this goes. I mean, if everything starts shrinking because of the chemo and because of the NovaCure, great. If things are progressing, but say you have radiosurgery to the new spot and that spot looks good, then you have to kind of play it by ear and consider all your options. Sometimes we do go back in there and clean it out again, so to speak, and sometimes even put in chemotherapy wafers. That's another option. But yeah, I do agree that the top priority is to get on a different chemotherapy regimen like the CPT-11, Avastin, and to treat this new lesion that's showing up deeper with radiosurgery.
How soon the radiosurgery?
There's nothing to be gained by waiting.
Okay.
So here,
within a month, 2 weeks,
okay.
I would do it.
and here we could do it here or
If you want to do frameless, we have a frame-based system here. If you want to do frameless, I can give you the name of a radiation oncologist that you can make an appointment with right away.
What is the, I've got the history with Frater.
Mm.
Is there
Yeah,
an advantage or
people
disadvantage? It seems to me there might be an advantage to staying with Frater, or is there not?
It's closer to home for you, so
Yeah.
I'm not against that at all. They should be able to do it also.
Okay.
Okay. Any other things? I noticed you have an acupuncture thing. We noticed in your. Would my dad benefit from acupuncture?
For stress,
Oh.
but not so much for cancer cells.
Okay.
I'm not that stressed. I want to cure the cancer.
Okay.
Well, let's do that. And
I'll give you the guy's name just in
Okay.
case, for instance, at Frater, if they say, oh no, we wouldn't do radiosurgery. I don't know why they would, but he could give you another opinion. Let's put it that way.
okay, very well.